Hi everybody, this is Shannon Clark with Babies After 35. We are doing an unusual live discussion in the middle of the week because I wanted to have Sara Reardon, or Dr. Sara Reardon, the Vagina Whisperer here on Instagram, join me for a discussion. So I'm waiting for her to join and then we'll add her in. Let me see if she's on here. Not yet. We'll wait. Oh, there she is. Let me add her in. There she is. Hi there.
Hi, Shannon.
How are you?
I'm good. How are you? It looks like you're at your work office.
I am. I usually do my live discussions on the weekends, but we had to reschedule one with you, and then I'm out of town this weekend, just to Galveston for the weekend with my family. So you so graciously agreed to do it during the week. So I'm kind of technically on lunch break.
Okay.
We'll have a live discussion during lunch break. And you're in New Orleans, right?
I'm in New Orleans. So you're in Texas?
Yeah. So I live in Houston, but I work in Galveston. So yeah.
Okay. Yeah, I am. I actually lived in Dallas for 10 years and
Yeah.
Austin for 2, but now I'm back in my hometown of New Orleans.
Yeah, and I love New Orleans so much. I really did. It's one of my favorite cities. So I'm a little jealous.
Well, thanks for working me in over lunch. Hi, everyone.
Hi, so you guys, I'm sure most of you know the Vagina Whisperer here on Instagram. This is Dr. Sara Reardon. She is a pelvic health, wellness, physical therapist, guru, all of the above. I can't say enough things about her. So I'm super excited. You guys know I've been doing a series of conversations and discussions with a lot of the pelvic floor PTs about various topics. But what I wanted to do with Sara, is it okay if I refer to you by your first name?
Yes, girl, please.
Sara.
Of course.
Good.
Nothing else. It's fine.
Yeah, so what I wanted to do with Sara is just talk a little about things in general. You know, I think we've pretty much well established that the pelvic floor can be affected in pregnancy. But can you just start by explaining, and I'll tell you why. I have a friend who is contemplating getting pregnant, and she's been watching my videos. And so she said to me, well, what can I do now before I get pregnant? So let's start with that. We know that the pelvic floor can be affected with pregnancy. Whether you have a C-section, vaginal delivery, how many ever babies you have, it can be affected.
Right.
So what can we do in anticipation of getting pregnant when we're not pregnant to help with our pelvic floor? Or is there anything we can do?
Such a great question. And so
Yeah.
I think the first thing is if you have issues, I would get them addressed prior to pregnancy.
Mm-hmm.
And issues can fall in the buckets of bladder health, issues like frequent urination, urinary incontinence, incomplete bladder emptying, things like that. Pooping issues like constipation, straining to have bowel movements, fecal leakage, and then also pain. So if you have pelvic pain, painful intercourse, tailbone pain, hip pain, back pain, I would just get an assessment. I think it's always helpful to know what's going on, kind of what your normal is before you undergo major, physical changes during birth. And during pregnancy. And so pregnancy itself can change your pelvic floor, but so does birth. And so that's why we see changes even with a cesarean birth, because a lot of changes are actually happening during pregnancy. So I think the first thing is be attentive. If you are having issues, just proactively get them checked out. And 2, once you get pregnant, I would go ahead and start meeting with the pelvic PT right away, so that you can start, even in that first trimester, making changes and learning strategies to help keep your pelvic floor healthy.
Well, and I think it's important to know, because it can be in between pregnancies. It can be if you've never been pregnant before, you could be having some of the things that Sara mentioned. And if that's the case, get it addressed and get it evaluated. Start seeing a pelvic floor PT so they can figure out exactly what is going on with you. We can't just attribute everything to childbirth. There could be something else that's going on, and especially when who have never had children. So maybe there is something else at play, and that we need to get that addressed, especially before we get pregnant, if we have the time to do that. So along those same lines, I get asked the questions all the time before I get pregnant the next time, or before I get pregnant the first time. Is there any correlation with how the wellness of your abdominal core and how that can relate to your pelvic floor function?
Yeah, so the core, we always think about the core as the abdomen, but it's really your abdomen, your pelvic floor, your back, and your diaphragm, which is kind of your breathing muscle underneath your ribs. So it's that whole canister that's really your core, but we only think about the front part. So and it's more with your abdominals and your pelvic floor. It's more an issue of pressure management than it is of, you know, what to avoid and what not to avoid. So pressure management means you really want to avoid things that cause a lot of straining and tension or pressure on your pelvic floor and your core. So early on in pregnancy, little things like instead of kind of hiking up to get out of bed, you start rolling to your side. Or, you know, maybe watching your abdominals when you're doing crunches or push-ups or any kind of core exercises where you might start getting a little bit of a separation between your midline of your abs. That would be a sign that that's not great pressure management. And the way that you manage that is learning to engage or contract your pelvic floor and core. So, you know, we go to these fitness classes all the time that are telling us like, suck in your belly button and pull in your pelvic floor. And we don't really know if we're doing it right. So that's where I also think it could be helpful to touch base with the pelvic floor PT to make sure that you have those strategies down and then how to adapt what you're doing during pregnancy. You can't just necessarily keep doing the same exercises because your body's changing. Your pressure in your tummy and your pelvic floor are changing.
No, so along those same lines, like listen, it depends on which trainer you're seeing, which gym you go to, which online class everybody has a different opinion on which ab exercises you should do before, during, and after pregnancy. Everybody has a different opinion. My take on it is this. I don't think that it's a one size fits all, and you can correct me if I'm wrong. What I think is for women who are considering starting childbearing or going through a process of having children and building their family, getting an evaluation to see where your strengths and your weaknesses are in your core. And that means the abdomen and the pelvis, to know which exercises are best for you, because not every exercise is the same. You know, you hear about, oh, this is what you need to do. You take this course to fix your diastasis recti. Well, that may not work specifically for you.
Totally. And
so
it's really an individualized approach. It's kind of like, oh, I have shoulder pain, and everybody's like, do this one exercise and it'll get fixed. Like, that's not really the way that it works. And there's so many things that play in for every person. And again, so many of these issues come prior to pregnancy.
Yes.
I think we just go through the most dramatic transformation during pregnancy and birth, but we see young women who have pain inserting tampons, have leakage when they run, have diastasis from kind of hardcore exercises. So it's women who have never had children, regardless of age, who may have issues as well.
So there are some things that we can do even as young women when we're, you know, we had the time to exercise, and I remember those times, that could have contributed to having problems with your lower back, which could also affect your core and your pelvic floor.
Yeah.
With straining, with the certain exercises we're doing that increased and it can cause a diastasis to some degree before you even have children. So, you know, being aware of how the mechanics of your body works and knowing which exercises are best for you. I think we highly underutilize pelvic floor physical therapists in general for those types of recommendations. Would you agree?
Yeah, totally.
Yeah.
And you know, the thing is it's not even about just exercise. I think we focus a lot on that.
Yeah.
But this is about day-to-day stuff we do, like peeing, pooping, having sex, picking up our babies, lifting groceries. I mean, these are things that we're doing in our daily lives that our pelvic floor and our abdominal wall are affected, and we're not necessarily trained on how to do that. So I literally just start with the basics with everyone. Like for urination, don't push when you pee, sit and chill and breathe and let your bladder empty itself. You don't need a strain. For bowel movements, you know, making sure you're exhaling as you're pooping and not holding your breath, because that can cause a lot of pressure on your pelvic floor. So use a squatty potty, exhale when you poop, make sure your poop's really soft and not too firm, because then you'll strain. You know, different, and like when you're lifting heavy weights, not holding your breath or using weight belts, exhaling when you do that. So all of these things that are just like 101 pelvic floor, but nobody's teaching them to us. So just different strategies like that, I think, can really help pelvic floor health.
And I think also, and we won't go too much into it. You know, I've been in the gym plenty of years of my life, and I think exercise, don't get me wrong, exercise and weight bearing exercise is great. But the mechanics of the female body are a little bit different. And you got to have somebody that understands that, especially for those of us, you know, when we're younger and planning on having a family or in between pregnancies. And not everybody, and I'm not discounting people that are in health and fitness, but they don't always understand why certain things might not be as good for you once you've had a baby and you're trying to recover. Yeah. So I do, while I'm all for and advocating for going back and getting your workout routine established, I do think that if you're having any symptoms, you're worried about a diastasis recti, you're worried about having pelvic floor dysfunction, utilize the pelvic floor PTs with your trainer so they can kind of work together on
we do that all the time.
Yeah.
Because I'm not a fitness professional. I'm not a, you know, those are going to be things that like, that's your wheelhouse. But again, this is the core foundation of everything we're doing. To have a specialist help you with that, I think is only going to benefit you. And so I think it's really working more collaboratively than like, you can only do this and I can only do this. I think it's huge, you know?
Yeah, it's a great. Yeah, so I do think that there is something to be said for that, as getting evaluated by a pelvic floor PT, so they can work in like Sara said, in collaboration with your trainer.
And so definitely postpartum. I mean, I think that every birthing person should go see a pelvic floor physical therapist after giving birth. I mean, even if you know, before returning to the gym, it's just like, you need to know how your muscles are functioning. What are your abdominals doing? Can you engage properly? All of these things, just to really, you know, it's like build that foundation before you just go back to running or lifting weights or yoga or whatever you're going to do.
Yeah. And I think as women, we're so, especially if we've been in a good physical routine, as far as going whatever method of exercise we prefer. And then most of us have to kind of lay off towards the end of our pregnancy. And we're so eager to get back in there, and we start going right back to what we were doing before we got pregnant. And it may not be the best thing to do. You might need to do some other things to get built back up to that point, especially if you pushed for a long time, or you had a C-section, or you had perineal trauma because you had a laceration that was removed.
100%.
So, making sure that we don't just jump right back to what we were able to do before pregnancy, you know, and getting evaluated to make sure if that's indeed the best route to take.
Yeah, and the thing is, a lot of medical providers, like physicians or midwives, aren't trained on how to assess muscles, which is okay. Like, I'm not.
I'm not. No,
and that's the thing. I think that's again where we really work collaboratively, where it's like, hey, just go check in with someone and make sure that this is going well, and it just makes a huge difference. And so I even look back to when I had my babies 5 years ago. And I was like back to running within weeks. And I'm like, what was I thinking? And I tell my patients now, like, take your time, because you really do, in the long run, will recover so much better if you just give yourself those 4 to 6 weeks to like take it easy in the beginning.
I agree. So let's start with someone who's never had kids before. And what would be some of the signs that she may be having before even having kids, that she has pelvic floor dysfunction or the potential issues with her pelvic floor? What would be some of the things that never been pregnant female might be experiencing?
So there's two things. There's kind of two tracks that I think about. And one is like pelvic floor muscles can be too tense or tight. And if you have overactive or tight pelvic floor muscles, that can lead to incomplete bladder emptying, difficulty with bowel movements, painful intercourse, painful pelvic exams or tampon insertion, pain with sitting, things like that. Or the other track is if the muscles are weak. And so that may lead to other things like heaviness or pressure in the pelvic floor, like feeling like something's falling out, or urinary leakage, or difficulty holding in poops, something like that. So, and sometimes, you know, people have both, which is, I know sounds kind of crazy, but the muscles can be really tight and tense, and then someone starts straining to pee or poop, and that causes weakness. So then you've got both of them. But, you know, if you do have this tension issue, which surprisingly a lot of us do. I mean, I find myself in the carpool line, I'm like, you know, and my ass cheeks are clenched. You know, like, chill out, Sarah. So with those things we're doing all throughout the day where we're like tightening our pelvic floors, and that's leading to this overactivity. So, you know, I really am a huge fan of yoga. If you're going to do any type of tightening like bar or CrossFit or even running and weightlifting, balance it with relaxation and lengthening of your pelvic floor and breathing. And then if it is more of a weakness issue, you know, making sure that you know how to do pelvic floor with contractions or Kegel contractions properly, you know how to use your breath with them properly and engage your transverse deep abdominal muscles. So, and then integrating that into exercise in your day-to-day life. So, you know, it's a strengthening or a relaxation track, but it's, again, it's so individualized. It's hard to say like everyone should do this or everyone should do that.
Yeah. And I agree. So if you've never had kids before and you have any of those symptoms that Sara mentioned, getting evaluated by a pelvic floor PT before considering, you know, getting pregnant and trying to address those symptoms is only going to help you to get yourself in the tip-top pelvic health shape before you get pregnant. And then you also might be told, you know, you might have an issue here, issue there that needs to be maintained and addressed throughout your pregnancy. to help keep that from getting worse with, carrying a baby and then delivering a baby, right?
Yeah. And another thing is if you are not conceiving or trying to conceive it, you may be on hormonal birth control. And we see a lot of young women who, have different changes in their vaginal tissues or vaginal dryness because of, estrogen from birth control. So, things that you don't always think about that like, oh, that's causing painful sex and I wasn't aware of it, or that's causing vaginal dryness or urinary tract infections or something like that. So there's a lot that could be going on.
Could be going on. Okay. So let's go into the woman who's pregnant or in a postpartum. Well, let's back up. She's pregnant and now she's having symptoms. What are some of the more common symptoms you find in your pregnant patients that come to see you? Or more common complaints?
One of the most common ones is urinary leakage. Those pelvic floor muscles are like a hammock and they're supporting the bladder. And when that hammock starts to get kind of stretched out and lengthened as the baby grows, you don't have as much support. And so leakage with coughing, sneezing, vomiting, laughing, picking up your toddler, those things can happen. And so really working with them to engage the pelvic floor. Diastasis recti or abdominal separation. Again, it's really common, but not everyone gets it, but it's a sign of pressure mismanagement. So, teaching them to avoid, certain exercises that can cause that, engaging their pelvic floor. And then other kind of one-off things like hemorrhoids and constipation or vulvar varicosities or varicose veins in the vagina or SPD, pubic symphysis pain. So kind of some of those more really specific pregnancy related things we see because of the change in the muscles and the ligaments of the pelvis.
Yeah, so you mentioned 2 or 3 things that I haven't discussed as much in some of these discussions. The first is going to be it's kind of called pelvic girdle pain, which includes symphysis pubis, diastasis, or dysfunction.
Right.
I will say, over the years, and I've been doing this for 20 years, I can remember women who had significant pain, a few that could barely walk.
Yeah.
And we really, I wasn't trained about what that could be. I was trained about where the pubic bone might have a diastasis and that could cause an unstable pelvis. But we would do an x-ray and it would look okay. So we were just like, it's just pregnancy. Well, we know now that it's not normal. And someone that's in that much pain, that's not normal. And no one should ever be told, well, you're pregnant and there's not a whole lot you can do about it. I feel horrible now because we didn't know about it as much then, because now I know you have the pelvic girdle pain that can cause with SPD, with sacroiliac joint dysfunction. And there are things that we can do. And you don't have to be in that much pain. And being in that much pelvic pain, when you're not contracting, everything else with the actual pregnancy is okay, that is not normal.
Yeah.
Okay. And that needs to be addressed. So let's talk about, we don't have to go in detail, but if you're having that kind of really bad pelvic pain where it's hard to even walk and your bones are popping, those are some of the common things I hear. That's a sign that you're having pelvic girdle pain or pelvic girdle dysfunction. What can be done in that situation? As long as we rule out anything else that, the actual pregnancy is okay, what can be done?
Yeah, so great that you're thinking about this. Because again, we used to say, oh, that's just pregnancy, and it is, but there are things that we can do to help make people more comfortable and functional. So there is a stability belt. My favorite one is by a company called Sorola, and it's like it looks like a thick belt, but it wraps around your pelvis. And I actually have my little pelvic model here. Okay. So we're talking about the pubic bone, which is in the front, and you can see there's a little ligament here that can get soft and kind of relaxed during pregnancy. So the stability belt wraps around your pelvis and kind of cinches you together. So it gives you more stability because your ligaments aren't giving you that stability. So that's one thing that I immediately tell people to start doing. The other thing is there are certain exercises that you may be doing that cause this to get worse. Anything where you're separating your legs a lot. But that even includes rolling over in bed, getting out of the car, taking steps. Walking stairs. I tell people to keep their legs together when they're rolling over in bed or when they're getting out of the car. If you're going up and down stairs, taking steps sideways instead of going one over the other, avoiding standing on one leg. So when you're getting dressed or you're shaving your legs, sit down to do it so that you're not shifting that pelvis and putting all, weight on one leg. And then the other thing is the way that you strengthen these little ligaments is doing pelvic floor and deep abdominal contractions. So, going to see a pelvic floor PT or working with someone who can teach you that engagement so that before you take a step or before you lunge forward for something, you can, engage those ligaments better. So it is a little bit of just helping someone manage it, but that they're
Yeah.
not in miserable pain. I mean, we've had people stop working or they can't take care of their kids because of it.
Yeah. And if for any doctors that are or will watch this, please, if your patients are doing this, please don't say just wait it out. If they're in that much pain, we need to send them to someone like Sara to be evaluated so we can see if there's anything we need to do. Of course, it's making, as long as everything else with the pregnancy is okay. It could be pelvic girdle pain and sacroiliac joint dysfunction and suprapubic joint dysfunction. It could be all of that. So we need to get them evaluated because I can't imagine being in that much pain. The other two things I wanted to bring up are hemorrhoids and the vulvar varicosities. So from an obstetrical standpoint, as someone who takes care of pregnant women and delivers pregnant women, the most of the time when I see these are, if you're talking about just pregnancy related reasons, are usually with moms that have had more than one baby, because what happens is all that blood flow going to the pelvis is there for a reason because it's supplying the uterus, right? So then you can get varicose veins in those areas, which is essentially what hemorrhoids are, and the vulvar varicosities, just as you would in your legs. It's because the pulling of the blood, the dilation of the veins. Usually I see it worse with women who have had more than one pregnancy, you know, as they get into the third, fourth, and fifth, but you know, you can have them earlier. If you're predisposed to having varicose veins earlier in age, you're more likely to get them in pregnancy. They can be painful. They can bleed. Some women have had them worse than others. There are certain things that can aggravate them and make them worse. There's not a whole lot I can do about them because they're there. But you can do something. You can try to help, right? What can you do?
I love talking about butt stuff because I feel like we don't talk about it enough.
Yeah.
But so yes, you are correct. I think there's a couple reasons that these occur. Is that one, the smooth muscle in your body softens during pregnancy. So your colon slows down a little bit, your the vessel walls soften. So you just get a little bit more pooling in your body, in the veins or vessels. You've got more blood flow. Again, you're creating baby, creating placenta, like all of those things require a lot of blood flow, and there's less movement. So everything's kind of pooling, gets heavy. And I tell people, this feels like you want to put your hand over your vagina and like hold it up, vulvar varicosities, because there's a lot of heaviness and pressure there. So again, there are some supports that can be helpful. It looks almost like a jock strap for your vagina. But I even wear it now when I'm on my menstrual cycle because I have a lot of heaviness and pressure in that area. And it just gives you a little bit of that support so that you don't have all of this pooling and heaviness and swelling. And again, you know, we have people who are teachers or nurses, or, you know, I'm a physical therapist. I'm on my feet all day. You can't just sit down and take a break when you need it. The other thing is that you need to avoid straining. So if you're having hemorrhoid, it's likely because you were straining during bowel movements or straining at some point during the day, during your workouts, during lifting heavy objects. So making sure your poop is super soft. I don't know what your thoughts on this are, but I have a lot of people who take magnesium when they're pregnant to help keep their poop soft.
Yeah, that you can't. That can be a treatment.
Yes. They always say check with your medical provider. Yeah. So just making sure, and then using a squatty potty and learning how to poop properly without straining. So that can really help minimize hemorrhoids. There are some topical ointments that can be helpful as well, that are pregnancy safe. And then for varicose veins, same thing. And also ice is really friendly for you. So putting ice over the area at the end of the day, like get that bag of frozen peas, you know, frozen water bottle, put it on your, right in the area at the end of the day to help kind of minimize or shrink these areas so they're not as uncomfortable.
Yeah. And so for the hemorrhoids, you know, make sure, I know it's embarrassing to talk about, but if you have them, you got to talk to your OBGYN. And, you know, we can give you some of the conservative measures, you know, witch hazel, you know, softening your stool and things like that, avoiding straining. But if it's getting really painful, and, you know, I will say that they have to be really bad for general surgery to intervene, to do something with the hemorrhoids. Most of the time it's going to be conservative measures, but going to a pelvic floor physical therapist too, to make some recommendations about some of the other things you can do to manage them until the pregnancy is over is useful.
You know, thinking about even Shannon, like some people may be straining, and the reason they're straining is because their muscles are so tight down there. So we often think about like all this looseness and laxity that happens during pregnancy, but a lot of people have tension. And if you can't poop, it might be because the muscles are too tight. And so working with a PT to soften and relax those muscles for pooping and for birth. You know, oftentimes women are going into birth and they have so much tension, they don't know how to relax and soften their muscles. for pushing, for bearing down for birth. So a lot of things that we help people to avoid all of that, that heavy pushing and straining.
Yeah, so all of those are good things. I've gotten a lot of questions about the hemorrhoids and the vulvar varicosities. So yes, they do happen, and there are certain things you can do about it. But I will definitely recommend, if you are having a significant issue with either, that you could see someone like Sara to get some more recommendations on how to manage them. So yeah. Okay. Now so we got through the pregnancy. Now let's talk about the actual childbirth part. A couple of just anecdotal things that I will say as someone who's delivered a lot of babies. I will see a lot of women, especially first-time moms, who seem to have really, really, really tight pelvic. But a lot, and we think about is it just because the bones don't allow? Well, I don't necessarily agree with that 100%. That it's the passage, which is the bony structure, the passage, which means what the baby has to come through. And yes, it includes the bones, and we hear about, that the way the bones are shaped in the pelvis can affect your ability to have a baby vaginally, but it's also the muscles.
Yeah.
If your muscles, it doesn't matter what your bones are like. If your muscles are like, it's going to be hard to push a baby out. Totally. And I will tell you, we're helping with pushing, and sometimes those muscles are so incredibly tight. I'm just like, and I've even seen it earlier in labor, and I've recommended, I'm not pushing epidurals. It's her choice. But I've seen it many times when they finally get some pain control, those muscles relax and allow things to progress. Yeah. So I know that having a tight pelvic floor to begin with can affect the progression of labor. And sometimes getting an epidural and getting pain control will help those muscles to relax. So we think about that too when you're pushing out a baby for the first time or the fifth time. You can have trauma to the perineum, which is that area between the vaginal opening and the rectum. You can have trauma to the rectal muscle, right? If the tear is bad enough. So assuming that the repair is done correctly, which is extremely important, and I tell my residents all the time, a good vaginal laceration repair is just, doing that perfectly is just as important as if we did a C-section. It's still a surgical procedure. We have to treat it as such, and we have to respect it as such. So what are some of the things after having a vaginal tear and having a vaginal laceration of any degree that could cause some pelvic floor dysfunction or pain? Sorry, I have a gnat that's driving me nuts. Or pain, or you guys can't see it. I know I look like I'm swatting. It's nothing, but it's a gnat and it will not go away. Okay, so what are some of the things after the physical act of childbirth and say there is some vaginal trauma there? What are some of the signs that you may not be healing correctly, or that you need to get some additional help from someone like yourself?
So these are great questions. So I want to backtrack just a second to talk about the pelvic floor during birth, because you're totally correct. Like what we need from the pelvic floor is to get out of the way during birth. And it's really the uterus that is contracting to help expel baby down the birth canal. If these pelvic floor muscles are really tight or tense, it's really hard to do that. And, I think I've actually had a lot of patients who wanted to go in for an unmedicated birth, and they ended up having an epidural, and that epidural helped them relax their pelvic floor muscles, and they had zero vaginal tearing, perineal tearing. So it definitely can happen. I think a lot of it is, when is that epidural taking place to either help the relaxation but not interfere with the pelvic floor muscles. So, and that's different for everyone. The second piece with regard to healing is that the first thing is you've got to let this area heal. So I always recommend ice in the very beginning. Again, we want inflammation to go down. Swelling and inflammation are primary causes of pain. I do want people up and walking just a little bit, but I think minimizing how much activity you're doing in the early days. This definitely gets harder when you have more kids. So for my first kid, I could just sit back and lounge and do skin to skin. The second one, I'm chasing after a 2-year-old or nursing a baby. So, but I think resting, getting help as much as you can. And then if at 2 weeks you are still experiencing pain, that's a sign that I'm I would want you to contact your medical provider, because there are times where there can be infection, if it's warm, oozing, pussing, anything like that. If bleeding gets worse, those are signs I would say check in with your medical provider. We typically see people around 4 to 6 weeks postpartum in our clinic, and I don't do an assessment until they've been cleared by their medical provider to do a pelvic floor assessment. And then again, sometimes I found like there's still a stitch there. It's pretty tender. They need, there could be some granulation tissue that's causing irritation. I send them back to their medical provider. Now, once you go back to after that 6 week mark, if you return to intercourse and it's painful, if you are sitting or squatting or doing something where you feel like it feels like it's tearing or too tight, I would check in with a PT. So those are kind of some signs. I think people really actually have a really good sense of their bodies. And I think it's up to us as the medical providers to hear them and not say, oh, that's normal, but to say, okay, let's check this out. And let's just check the box and make sure everything's normal. So depending on where you are, I think there are different stages as to when, kind of what you would look for healing.
Yeah, and I think I will say this again, as someone who's delivered a lot of babies, I hear all the time from women who have a C-section, how do I take care of my scar? How do I take care of my wound?
Yeah.
I hardly ever hear anybody said who's had vaginal lacerations ask me the same thing. Because I think it's just kind of, I don't know why it's overlooked, and it's even overlooked by the patients to some degree.
Yeah.
And I'm not sure why that is, but I think
it's less visible. I think people can't see it.
Yeah. And maybe that's what it is. I don't know. They don't consider it as important as maybe if you had a C-section scar, but I'm here to tell you it is as important to take care of that area. So if you had a laceration or had to have stitches in your bottom, ask your doctor where your lacerations were.
What grade? People don't know what grade their tears
What grade they were, if they were up around your urethra, around your clitoris, anywhere else into the vaginal vault, through the perineum, through the rectal sphincter, through the rectal. You need to know exactly where your tears were. You need to have a good plan of care once you leave the hospital of what you can do at home to care for your bottom. And we have things that we can do, stool softeners, the sit spas, you hear about all those things. Make sure that you put just as much importance on caring for your bottom as you do if you had a C-section scar. So I can't stress that enough. It's very, very important that we do that. So yeah,
and one thing I will add is that, if you do have, just kind of, we coach people on perineal massage during pregnancy to prepare for birth. We'll also do that for scar tissue massage postpartum as well for the perineum.
Yeah. So and everyone heals differently. I've seen some women who, had a couple of babies and I could tell they had pretty significant tears before and they had no symptoms. Then I've had women who've had one vaginal delivery and are already having symptoms. So it's different for everyone.
Yes.
So don't think that just because you had one baby and you're having symptoms that you're complaining too much or that you shouldn't be complaining. Your body, and if it's not getting back to normal and something's not normal, you need to be assessed so we can figure out exactly what's going on.
Yeah.
Yeah. Okay. So now we talked about with childbirth. Now the postpartum period. Say she's a few months out. What are some of the things that can linger on where you're thinking, you know what, we're beyond the healing stage, even if she's had a C-section, but she's having certain symptoms that might indicate that something's going on.
Yeah. So again, everybody should see a pelvic PT after giving birth. Plug one. So let's talk about cesarean births. 30% of women are having cesarean births. What does follow-up care look like for that? So definitely if you are having numbness, sensitivity, discomfort over your scar, if you don't want to touch your scar, if it's hard to wear pants or for your kiddo to lay on it, anything like that, I would check in with a PT to start working on scar massage. Another thing is for the abdominal wall, if you see a separation, a coning, a doming, in what we call an invagination, where your fingers can kind of sink in above the belly button or below the belly button, and you see that when you're exercising, when you're getting out of a chair, I would go ahead and check in with a PT as well, because that's a sign, again, of a pressure issue in your abdominal wall that what you want to get addressed before going back to working out or whatever. For vaginal birth, common things are urinary leakage. Well, anybody can have urinary leakage, but other things are painful intercourse. Intercourse can be a little uncomfortable the first time you have it. You may have some vaginal dryness, but it should not be painful. Yeah. And so that is one of the most common complaints that I think that people just kind of deal with. Yeah. And it's really something that could be addressed quite easily. Same thing with, returning to intercourse. Return to exercise if you have leakage. Pressure or heaviness in the pelvic floor, like something's falling out, could be a sign of prolapse, any of those things. And then even just more orthopedic issues we don't talk about, like back pain or sacroiliac joint pain. Or, I had a lot of shoulder issues. I was breastfeeding all the time. I was carrying my baby. I had shoulder pain and neck pains, and I went and saw a PT specializing in postpartum for these issues. Wrist pain, you know, all of these things. We were doing all this stuff, and our bodies are just trying to kind of keep up with us. So, you know, all of these things I think can happen postpartum. We don't really think about them.
Yeah, I mean, and there's so much mechanically that, and I think for a while I just got to used to being in pain all the time.
Yeah.
Because I had twins, I was back to work. I got tendonitis in my elbow. I had to get steroid injections. I had lower back pain for being on bed rest for 2 months. And it's hard to address all that. But if you don't, it's going to catch up with you, because it's catching up with me now. I promise you, I can attest to that. You got to take care of yourself and your body, because after a long period of time of neglecting it, which I did, it's going to, eventually you're going to have to address it. So,
and I think that's another thing though, is that, you know, you and I are in this field and we have issues. So the majority of people aren't. So it's like, you know, they're not getting that information of like, hey, there's something to help this, which is why it's so great you're doing this, because we just want people to feel like they have options versus just dealing with it.
I agree. So there was one other thing I was going to, and then there's a bunch of questions here. We're going to ask that. So let's talk about the C-section thing. As I'm a high risk obstetrician, so I do a lot of C-sections, but they're not just because a woman has stalled labor. A lot of it's indicated because of fetal and maternal conditions that require, and that's the safest route of delivery. I want to say first and foremost that in an otherwise uncomplicated pregnancy, I'm all for vaginal delivery. Absolutely all for vaginal delivery. I have women who ask me for an elective primary C-section. That means she wants to have a C-section and she has no medical indication. I will counsel her and have the discussion, and we'll make the decision together whether or not that's the best. But the fact remains is that the C-section rate is high in the United States, and it is for various reasons, and we won't go into all that. But one of the common things I hear is, I just want to have a C-section because I want my stuff. I don't mean to be crass. I don't want anything to happen to my stuff down there, and I want to preserve my pelvis. So does avoiding a vaginal delivery, is that going to protect your pelvic floor?
No. Research is really showing that a lot of changes to the pelvic floor happen during pregnancy itself. Again, it's that hammock of muscles and ligaments that get elongated and stretched out. And that needs to be rehabilitated regardless of the method of birth. The other thing is a cesarean birth is a major abdominal surgery. And so the recovery is very different, and there are different risk factors associated with that. I do have women who opt for an elective C-section with their medical providers, and that may be someone who's experienced trauma, who's had a previous cesarean birth, and they don't want to attempt a VBAC. You know, I had placenta previa, so a cesarean birth was a very real, you know, something I was really going to have to consider if it didn't resolve. So there are a lot of things that can definitely, where it's necessary and indicated. But no, it's not something that will, you know, avoid pelvic floor issues. And again, there's research showing that women who've had cesarean births are more likely to experience painful sacs because of the fascial connections of the abdominals and the pelvic floor. So definitely other issues to consider.
And the point I'm making here is not that you're not entitled to that. If that's what you want and your provider agrees to it and you guys discuss the risk and benefits, and I'm all for a woman making a decision that's best for her. But what I'm saying is don't think that if your reason is because you're going to protect your pelvic floor, that's not necessarily going to happen. So just keep that in mind. You may have other reasons for wanting that first C-section, and that's perfectly reasonable. But don't base it solely on the fact that you think you're going to protect your pelvic floor, because, you know, yes, you will avoid actually pushing out a baby and potentially harming your perineum, but you might also have problems with your abdominal muscles too, and all of that. So it might kind of even out in the end. Does that kind of make sense?
Absolutely. And I think your point is so great. It's really about making a decision together, knowing options. You know, I think a lot of people feel like they're getting pushed in one way or the other. They feel like they're the passenger in the process, but really they're the driver, and you're making the decisions alongside your medical provider. And, you know, again, I think that people who really feel empowered in the decision-making process are happier and more satisfied regardless of the method they birth. They just feel like they were a part of the process. Yeah, of course.
And we as physicians, we have to respect that and understand that that's extremely important in any medical decision making, but especially in pregnancy, when you have two patients in one, we have to consider both. So it's important that we do that. Okay, I'm gonna stop and answer some questions. We'll see what questions we have. Let's see. Yes, okay. Okay, do those pelvic floor pants work? Do you know what they're talking about, pelvic floor pants?
I don't, but I'm assuming if it's something like kitschy that says it's going to like cure all your problems, it probably doesn't. So I get messages all the time. Like if I sit on this ball for an hour a day, will my vagina get super tight? And I'm like, nah, it's not going to happen. So, but there are some pants that are compression pants. So if this is what you're referring to, there are pants that you can wear during pregnancy or postpartum that have compression that can be really helpful for a diastasis recti or prolapse or,
the varicosities.
The varicosities of pelvic pressure. So those things can be helpful in just giving you some additional support if that's what you're referring to.
Yeah, and then another question is, can you have these issues, and this was earlier on in the discussion, some of the symptoms you were talking about, and only be 34 years old? Yes, the answer is yes, you can. I had a patient who, I think she's 21 or 22, had her second baby and had already had major uterine prolapse. So it can happen. And I've said this before on a previous discussion. There probably is a genetic component to some degree with some of the women who have 1 or 2 babies and do have significant prolapse. We're still teasing that out, especially if your mom had it too. It could be just be more of how you're made. But yes, it can happen even at a very young age, for sure.
Yeah. So someone just asked about the waist trainers. So no, I am not an advocate of waist trainers.
What's a waist trainer?
So a waist trainer is like a tight band that you put around your abdomen to help your abdomen shrink back down after giving birth. And I say this, I'm not a fan of them because the focus is on like shrinking your waist versus actual like recovery of the tissues and muscles. So again, I think after a cesarean birth, you can have these kind of gentle abdominal supports.
Yes.
But those trainers that really squeeze you, if you think about a tube of toothpaste, and the opening to the toothpaste is down towards the bottom, that's your pelvic floor. So if you squeeze in the middle, everything's going to come out the bottom. And those pelvic floor tissues are very vulnerable and they're really healing after giving birth. So I'm not a fan of doing anything that's going to cause a lot of compression at the midsection.
Yeah, and putting more pressure down there, which is what we're trying to avoid.
Exactly.
With the pelvic. So along the same lines, a lot of times my patients, I'll send them home with the abdominal binders to help kind of stabilize things. But it is important that you don't rely on an abdominal binder, correct? Because if you rely on it too much, you might end up making the area weaker and then putting strain on other muscles that weren't in strain before, right? You still need to give your abdomen time to work itself, right?
Right. So the feedback that I've heard from a lot of patients who use this and as a PT is that I think it's fine. I don't tell people to not rely on it as much. In the early days, I feel like it helps them feel really comfortable, but you still need to modify the way that you are moving.
Yes,
so when you're getting out of bed, when you're picking up your baby, when you're getting off the yoga mat, not straining your abdominals to do that. So it does give you support, but around 6 weeks, I think that you should be more likely engaging the internal muscles versus relying on the trainer.
Right.
Or the waistband.
Waistband, okay. Let's see. I went to a pelvic floor physical therapist 8 weeks postpartum because of you. I don't know if it was me or you, but either one, it doesn't matter.
We'll take it.
I'm glad. We already talked about hemorrhoids. Oh, Nicole. She said we both rock. Thank you. You rock too.
Love Nicole.
You said waist training. Okay. After my first pregnancy, I had bad back pain. With my other pregnancy, that I can't walk, especially between 2 to 3 months. With my other pregnancy. So I think she's saying after my first pregnancy, she had bad back pain. And then another pregnancy, she started having really significant pain between 2 and 3 months pregnant. I think that's, So it could be carryover from her previous pregnancy.
Carryover. And again, if you haven't really rehabilitated your core, your pelvic floor, your ligaments, they're going to soften really quickly in the second pregnancy. And that's where you get that instability of the pelvis, of the joints that can cause pain. So that's where I'm like, go check in with a PT. There are so many simple things that we can help guide you to do that can really help your discomfort. I would hate for you to feel uncomfortable for 6 or 8 more months, thinking you just have to deal with it.
Yeah. So I think that's all the questions. But this was a great discussion. I love it.
Yes.
And thank you so much for educating. You can find Sara Reardon, Doctor of Physical Therapy, pelvic floor wellness guru, at the Vagina Whisperer here on Instagram. You guys probably know her because she's really, really popular.
But thank you. I mean, it's really great to be able to have these open conversations, collaborative conversations with physicians, because I feel like you are the boots on the ground too. So it's really so awesome to be able to have that collaboration and support.
Well,
I know I appreciate it so much.
So what I think about this is, look, I was trained to to do a lot of really cool stuff with high risk pregnancies. And I went through a lot of training to do that. We were not trained on this. And I think every physician, we have to know where our weaknesses are as far as education and what we can do for our patients, because if we don't acknowledge that, then we can't help them. So being able to know that, you know, I can't tell someone what to do with their pelvic floor. This is who can. It's only going to make our patients better, and it's going to make us better doctors to understand, you know, where we can't help our patient. And I think as doctors, sometimes we think we should be able to do it all, but the fact remains is that we can't, and nor should we, because that's not my job. So that's why I'm glad I have people like you to do this, because then I can say, you know, I really don't know. And I'll be the first to tell you as a physician, I'm the first one to say, I don't know. If I see a rash and I don't know, I'm not going to just say, well, it's just a rash, come back in 10 weeks. No, somebody else needs to go look at it, a dermatologist. That's what we're supposed to do. Okay.
Yeah, and I feel the same way. People come to me all the time like, can you do this? And I'm like, that's outside of my scope of practice. I'm a muscle specialist. Yeah. And, you know, outside of that, it's like you really need to go check in with your medical provider, because that is where my limitations are as well. So,
and then along the same lines, as a patient and as a woman, advocate for yourself. If you feel like it's a significant issue and you feel like you're not being heard, find someone that will hear you, or advocate for yourself. And you say, you know what, something needs to be done. Who do you recommend that I go see? So sometimes if you put it to your physician that way, then they're going to kind of have to send you somewhere else, right? Because you're advocating for yourself and you want something done. And there's nothing wrong with that.
So, well, we need more doctors like you. So thank you so
well,
much.
I have other things I have to worry about. And I wish we were taught about everything in medical school, but it simply doesn't happen. So that's where you guys come in. And I've told you before, anything with the pelvic floor, nutrition, because we don't get a lot of nutrition counseling. I love my nutritionist. Anything with neurology, not anything, but most things with neurology, I have no problem referring to neurology. So yeah, I know where my weaknesses are.
Everyone so much.
Yeah. Thank you so much for your time. Have a great rest of your week.
This was great. Good to see you. Bye.
And it'll be up. All this discussion will be up on my Instagram soon.
Yeah. Thank you. Bye, guys.
Bye.